to Mindvine, a mental health podcast for everyone. Since our first episode in 2016, we have been sharing stories of recovery, engaging with experts, and tackling the stigma associated with mental illness. The Mindvine podcast is produced by Ontario Shores Centre for Mental Health Sciences and is available on YouTube, Spotify, and Apple Podcasts.
Welcome to the Mindvine podcast. I'm your host, Darryl Mathers, and today we are talking dementia, and in particular, dementia in our community. It's estimated, I think, by the year 2050 that there's going to be 2 million people, nearly 2 million people in Canada diagnosed with dementia. Certainly a topic in the media we're hearing more and more about. And on Ontario Shores, dementia is a big part of what we do in terms of providing care to geriatric populations. And it's also part of this unique partnership that we're going to discuss today, and along with the other issues impacting dementia care. So I'm pleased to be joined by Dr. Amer Burhan, our physician-in-chief here at Ontario Shores, and Dr. Winnie Sun from Ontario Tech. Thank you both for being here.
Thank you for the invite.
Maybe we can just start the conversation by talking about dementia and why it's crucial that we start talking about advancing dementia care at this stage.
Yeah, I know that it's probably what we're going to say is not brand new. The challenges that we're having with dementia has been building up for quite a long time. And I think we all know that it's an illness that unfortunately we have not been able to avoid, and it is associated with aging. So as our population age, in the sense that there's more people living in older age group, we are obviously facing that diagnosis more and more. And the impact of a diagnosis like Alzheimer's disease or other forms of dementia is just tremendous on the person, on their families, and on the system of care. So really from personal perspective, as a member of the society, from a healthcare provider perspective, researcher perspective, it's all important to address what is the meaning of this to our society and our community. So,
yeah, I agree with Dr. Burhan. You know, it's very important to really look at how we can prevent or mitigate the risk of dementia. And we know that there are modifiable risk factors that, you know, it could help prevent or even slow the progression of dementia. Or some of the things that we can do for a person with dementia and their families. So what are the supports and resources that would actually be helpful to a person with dementia and their caregivers to actually have a better quality of life in the journey?
The two organizations, Ontario Tech and Ontario Shores, have partnered to conduct research and utilize technology to advance care. Can you tell us about what that partnership, like the formalized partnership, is and what that might mean for care in our community?
Yeah, I mean, we're very excited that we got to reach this point where we have that partnership formalized. I'll just say a few words and invite Winnie to add. I think as a care organization, Ontario Shore is a specialized mental health center, and we do have in our mandate to care for people who have dementia, and of course we all know that the care for people with dementia have been struggling in terms of the quality of care and making sure that we give people the care as soon as we can. So that care need translated to, of course, research questions in terms of what is the best way maybe to prevent it from happening, treat people as early as possible, provide support to patients and their families, and make sure that that's done in a way that's also sustainable. That we have the workforce that's prepared to do it, and so on. So from my position as a clinician, as a researcher, as an administrator, those questions are happening every day. Now, of course, we look at our partners from Ontario Tech because they have invested in understanding what tools that we have in our hand now, or we can develop to facilitate this. So maybe inviting Winnie to kind of comment on her role, because that ended up being how we met on the grounds of trying to make a difference in the life of people with dementia and their families.
Yeah, and I think what Ontario Tech University can bring in is the expertise in the technological innovation. So we have that a lot of the expertise in terms of developing innovations, new approaches, simulation, and these are the approaches that we can actually use to help support person with dementia and their caregivers to have a better, better quality of life. And also, as you said, you talk about the importance of partnership with the graduate students. And we already developed a lot of partnerships between Dr. Burhan and I to supervise students to explore more studies to actually look into what other research questions that's out there that is are very significant to help with promoting dementia care. And some of the graduate students take the lead on developing those research questions, implementing those research studies, and that really helped to advance our ADCC, our center, to really look into some of the leading edge research studies that would be very, very beneficial to the person with dementia in the future.
So you mentioned the ADCC, which is the Advancement for Dementia Care Centre, another acronym in mental health, who would have figured? So that's the partnership between Ontario Shores and Ontario Tech. But there's going to be more to that partnership down the road. So what is the ADCC? Like, what do you envision it being, or I guess what it is today, and what do you envision it for the future, and what's it going to address?
Right. We get you to start now.
Okay, do you want me to talk about the...
Yeah, I mean, I think probably sharing some of the work that we already started working on and some of the areas.
Pillars, maybe?
Yeah.
Okay, I'm just sorry. I just have to look at the pillars because that's important to showcase the pillars. So in the past, we already developed some technological innovations that already benefit Ontario Shores. So for example, I have been leading a project on virtual reality reminiscence therapy. And that is a project funded by Ontario Shores. And that the study really looked into how reminiscence therapy can be enhanced by virtual reality. And some of the preliminary results have been very positive, and it really, really helped enhance the person with dementia's mental health and well-being. So that's one of the examples of some of the success in terms of funding coming from Ontario Shores in the past. And in the future, we do have some other research pillars that we wanted to achieve by the ADCC Centre. So, for example, an example is to advancing some evidence-informed person-centered care for a person with dementia. We wanted to make sure that the research that we're doing is really person-centered care. That is very important. And another research pillar that we wanted to focus on is to promoting the quality of life and the journey of recovery for the person with dementia and their caregivers. And the other research pillar that we focus on is to leverage the partnerships to build a competent dementia care workforce, which Dr. Burhan already talked about. For example, some of the micro-credentials projects that we are currently working on right now is an example of how we're trying to leverage the partnership to build a more competent dementia care workforce to prepare for the future of a person with dementia that needs and some of this to support the workforce planning and in development in the future.
Right.
Yeah. The other pillar that we wanted to focus on is to develop technology-enabled care to support person living with dementia and the caregivers. So really focusing on the technological-enabled care interventions that would benefit the needs of person living with dementia.
Yeah, I mean, as we stated earlier, like the challenges that we see in our care models today is that there is a disproportionate need that people with dementia have that we may not be able to meet with the current resources that we have. So finding a way to enhance that delivery of service through technology and through, but also like doing it in a proper scientific way so that it become valid, measurable. So I think Winnie mentioned several things. So the patient themselves and her, who's in the care in the hospital or in the community, their providers, but also the workforce, and how do we make sure that if we have limited resources and people feel burdened by the amount of work that they have to provide, how do we actually enhance their skills, but also create more opportunities for technology to assist them in provision of care. So one example that was mentioned about virtual care or virtual reality as a way to actually deliver a very interesting and important method of treatment, which is the reminiscent therapy. So a person with Alzheimer's disease tend to have a problem making new memories, but they're able to remember old things. And I think being able to give them that comfort, to give them the older memories. So in this particular example, instead of the person have to do it by kind of doing it through the therapist, and it requires a lot of resources, virtual reality become a way to customize and provide it to a wider range. So if we prove that this is a valid way to deliver reminiscent therapy, then you can think of how much it's upscalable, or you can actually deliver it at a wider scale with less resources needed, right? So just an example of how leveraging technology and science to make care more upscalable and continue to deliver the same value.
As you're just talking about the work you're doing and hope to do, it just occurred to me that dementia, like a lot of complex mental illnesses, it's very messy, but it can be very. It would appear to me both for the individual involved, the family, the people in the healthcare institution that they're delivering care. It could be a very overwhelming experience. Like, are there enough? I guess what I'm trying to say is, the work the ADCC is doing and other organizations around dementia research is trying to catch up in terms of providing tools to treat dementia. Like, is this an area maybe where there's been gaps and like we see the tidal wave coming and we need to start implementing and having these tools available to people because they're going to need them soon?
Yeah, I mean, how fast we can meet the need is a big issue. I mean, we know that we haven't even mentioned the issue with long-term care and how do we, really redesign the care in long-term care, where it is a medical facility, but it's also a home for people, and to make sure that people access their personal life in the context of a facility that is considered medically regulated facility. So you're absolutely right. There's a huge complexity to the illness itself in one person, but it's even more complex when you add to it the family needs and the complexity of family interaction, then the society, and even our society is designed to accommodate the need of people with disability from dementia. So there's a lot of aspects to this. I don't think we can claim we can do it all, but at least what we can do is to start with the area that we're mandated to do, which is caring for people with mental illnesses just stemming from dementia, for example, like behavioral symptoms of dementia, caring for their families and caregivers, and how do we actually make sure that they access that support. Now, the center that we have partnered to create is a center that the solution that we're developing is actually answering a care need question, right? So we can start at least for where we're at now. How do we maximize what we do? And how do we make sure that technology answers the question to move us from the current capacity to a bigger capacity? The work that Winnie have led in terms of looking at micro-credentialing is really meant to say, if you're a nurse that have graduated and you never had a chance to actually learn anything about the care of dementia and crisis intervention, can we actually bring you that through a method such as the micro-credentialing, through a virtual environment, through a simulated environment? So you can see that it's going to be a diverse set of projects, but in the core of it is really care enabled by technology and scientific method.
The start of the partnership and the work you're doing and plan to do, what's been the reaction from maybe the dementia community at large? Like, are they excited about what you're doing? Do you anticipate like the ADCC growing? What has been the response from your community about what the potential of the ADCC might be?
Yeah, I don't know if you had that.
I believe that the community has been very excited about ADCC because, for example, the micro-credential project we are working in collaboration with the Durham Region Long-Term Care, and they're very excited to collaborate with us to develop these micro-credentials modules, and then looking at how these micro-credentials modules in dementia care can actually address the needs in the long-term care setting. Because as Dr. Burhan alluded to the fact that there is a major issues in terms of recruitment and retention of long-term care workers and who are specializing in dementia care. And that because of the lack of skills and preparation, the burnout is phenomenal. And that is a huge issue if we are not preparing these workers to have that skills. In the future, there will be no support in the future for person with dementia, and that could be very problematic. So these micro-credentials program in collaboration with the Durham region in long-term care, it's already a very, very good partnership, and they're really welcoming that ongoing partnership for sure.
Yeah, and the dementia field has a lot of workers from around the country. I mean, Toronto is a very busy place when it comes to dementia research. We have different people working on different aspects. I think the way we position ourselves is really stay within the care orientation and stay within the application of technology to enhance care. And that's why we coined that, as Alzheimer, or advancing dementia care in particular, because we want to stay in the care and we want to stay in advancing and innovation. And that will allow us to be positioned very well within the bigger community. I mean, we have, Ontario Shore has the partnership with the Toronto Dementia Research Alliance, and it has different people doing different type of work. But this area, in terms of technology-enabled care, is an area that we have ownership of, and we want to partner with Ontario Tech to actually bring to that network. And I think the reality is that we're not the only people working on technology and dementia, but if we can make it meaningful, that this is relevant to enhancing the mission of care and enhancing caregiver interventions, for example, that will give us really that unique contribution. We're good partners, and we like to be part of that network. And I think the reaction has been, as I agree, very positive, and they really want to hear more about it, and we want to showcase it as much as we can.
Yeah, another partner that we have is Alzheimer's Society of Durham Region, and they're also very excited about ADCC because in the past, their focus is on the education of dementia care, but there is a lack of research that's missing. So, with our ADCC Center, that would be one important piece to fill in the gap, is the research piece. How to research in terms of the technological innovations, some of the new approaches of dementia care. So that is something that the community is very excited about.
Where does the Living Lab fit into what the ADCC is going to be doing?
Yeah, I think Living Lab is an interesting concept. It's not really that common in mental health space. I mean, I think I've seen it in other medical areas and health areas. But so one of the ideas that Ontario Shore really have been advocating for and really leveraging our connection with Ontario Shore to pursue is that if we can provide our care environment to those who are interested in developing solutions for healthcare problems, right? But create a bit of clarity in terms of the principle, like making sure that people who are developing a technological solution, for example, are aware what does it take to actually safely implement this in a healthcare system, worrying about confidentiality, about approvals by regulatory bodies. So the Living Lab is really a concept to say that we will offer a safe way to interact with innovators and give them the opportunity to test their solutions as long as it's done under supervision of scientists and clinicians to make sure that it's done safely and with the safeguards to protect patients and families from any undue harm, right? So I think a center like ours will be, once we continue to add more value to it, it will be an attractive place to innovators to say, for this particular problem, I think my solution might fit. what do I do now to test it, to validate it, to upscale it, and maybe to market it down the road? I think that openness to that process is important. But as I mentioned, I'll emphasize again, safeguards are important, and make sure that people are being protected through that process so that we don't lose track of the main mission of the hospital and health system to care for people.
Yeah, the other thing I want to add to that is the Living Lab is really also about not just the development, and that during the development process is the co-designing with the patients and the caregivers. We wanted to develop something that is not from the researchers' perspectives, but from the users' perspectives. And that is a very key principle. And also the implementation, really focusing on how do we promote the reach and adoption, right? We want to create something that the users will actually use them and not creating something that is not usable, right? So that is also the key focus of our work is the scale up, right? How do we promote that scaling up of that technological or new approaches?
In terms of the ADCC, what do you hope that this partnership may achieve in the next year, next couple of years, even 5 years out? What do you anticipate some of your milestones being?
Yeah, I think probably our first milestone was to reach this point where we have a center and we have already established joint projects and working together in a committee that help us kind of organize ourselves. I think, now that we have this, I think the first year would be to see if some of these projects that we initiated are actually showing the progress that we're anticipating. But I hope that eventually it become an ongoing, challenge, solution, implementation, and scaling solution. So basically, a challenge come up from a question that consumers ask or we ask. And by the way, when I refer to consumers, it's really patients, families, providers, funders. I mean, all of us are in this situation. We may ask a question to say, what is the best way of delivering this particular service? So that challenge needs to be met by a solution, inviting maybe some of the innovators to come up with these ideas and finding a way to vet that. So all this is now in the beginning, but I'm hoping that in 2 years it will be a solid and we'll get a stream of these these cycles. And in 5 years, I really would love to see us internationally known for this, to say that this center is not only scientifically great, but also they have the immediate implementation of the science and the solution to the care model, and that the upscalability of this is so easy to see, right? It's something that translates very quickly to something that we can actually share with the world.
Yeah, I agree with Dr. Burhan. What you said about making an impact, right? We wanted our center to make an impact, and a lot of our future research study will not only focus on the development of the technology, but also focusing on how this technology make an impact and transform the lives of person with dementia. So we'll do some more research about clinical research to study that impact. And the other important thing that I envision it's important for our center is the policy impact too. So right now we are focusing on the technological innovation and interventions, but in the future we wanted to focus on how our ADCC can position ourselves in a more policy-oriented state so that we can actually influence the policy of dementia care. And that would make a bigger impact for the lives of the person with dementia and the caregivers.
If people or organizations in the community want to learn more about this partnership, the ADCC, what can they do? Where should they go?
Yeah, I'm hoping that we now have a very good starting point, which is our website that I'm hoping that's going to be launched soon and seem to look very good from what I've seen. And I'm hoping that this will be at least a placeholder for giving people update on what's happening, but also coming back to the point that Winnie had made, really inviting people to be part of the co-design, because it's not enough for us to come up with genius idea, test it, and then now launch only to find out that people are not even interested in it, or they didn't like aspects of it. So I think inviting people in a mutual bi-directional way to actually see what we do, hopefully through that website. But maybe, eventually we want to do some kind of community engagement opportunity. So every time we have the opportunity to speak to Alzheimer's Society or learners, of course, a big vehicle of connection to the community. So it's really multiple channels, but really the website and events like this where you get us to share our thoughts, in a place that people can watch.
Yeah, absolutely. And the other thing that we definitely wanted to do is the stakeholder committee, asking people to join in some of our stakeholder committees to offer their input and expertise to provide us with some of the insights into our future work. Yeah. So that would be really, really useful.
That's excellent addition. One thing that I mentioned is trying to find opportunities to speak to a wider audience. So I think your point about actually inviting people to be part of our committee is definitely more substantial. But I think, like, for example, we're going to be speaking to the citywide round in the Department of Psychiatry at the University of Toronto. Actually, we're going to be talking about a lot of the projects that the center has created. So it gives us a chance to speak to the whole community of people working in the field. And that will also invite people to connect with us and either collaborate or participate in the co-design and so on. So we're going to use every opportunity. That's the bottom line.
The website's dementiaresearch.ca, the one that you referenced. You two are essentially the drivers of this from your both organizations. Obviously, Dr. Sun from Ontario Tech, you from Ontario Shores. You're the ones that are leading this kind of partnership. What inspires both of you to keep doing this work?
A lot, I guess. I don't know if you want to start today or...
You want to start? Yeah. Oh, okay. For myself, it's actually really interesting. I actually read 2 books from an author that inspired me to go into this work. And this book is called What I Wish People Knew About Dementia from Someone Who Know. And it's by Wendy Mitchell. She also wrote another book called Somebody I Used to Know. So those 2 books really talk about how she had an early onset dementia in her late 50s, and that she now has dementia for about 8 years now. And she talks about how these 2 books can help people understand what it feels like to have dementia from the inside. And I think that's very inspirational to me, because as a researcher, sometimes I look at the facts, I look at the numbers, but what about the lived experiences of the individual? Their perspectives is truly what it matters and the essence of research to me. So I'm truly inspired by those 2 books. That's how I got into this work.
Yeah, that's amazing. I know that my journey in medicine was really not geared toward dementia. I started looking at medicine as a field of science and helping people. And then I got into neuroscience and the brain, and I was very interested in brain and behavior. But over time, these experiences became more and more personal, because I started seeing, in fact, in retrospect, I learned that my grandmother, who lived in another country, developed dementia and ended up living in a long-term care and passing away there. And then, so it ended up being closer and closer to home. And now some of my other family members, my mother-in-law is dealing with that illness. And so seeing it initially as a more of a scientific, technical thing and intellectual thing, and then gradually start seeing, well, it's really not that far from all of us. And then you start asking this yourself, what's going to happen to me when I get to that age, and asking those important questions. So it became not only an intellectual pursuit, it became a personal involvement. And I have to say as well that when you think about recovery and understanding the person behind the illness, I think some of those amazing books and movies, for example, Still Alice is a book that I read, and I saw the movie as well. And then the most recent one is The Father by Anthony Hopkins. So that depiction of what the experience of that person, it really added much more depth to the science. So while I still enjoy the science and the cells and what's happening in the networks, and I will continue to leverage that to help people, knowing that there's a person there and speaking to them as people, and their families and what they're going through is really, and actually, some of the stories from our patients and their caregivers, inspirational, like a person who cared for their loved one till the last minute, and they don't want to, let go, and you have to give them permission to say, maybe it's time, because you're already exhausted. So every person has been an inspiration for me, like throughout the journey of care.
Well, it's been an inspiring conversation. Thank you both for being here and sharing about the ADCC, this partnership, and the work that you're doing and the work that we hope to do in the future.
Oh, thank you very much for having us.